The mission of Open Door Health Center is to provide high-quality, affordable medical, dental, and behavioral health services for everyone in our community.
My first daughter introduced me to healthcare pretty much from the start. She was born with a congenital heart defect, and one of the things that was probably most surprising to me in dealing with a congenital defect is the emotional health, especially as a small child. I think people in this community should support Open Door because it's providing care for people who wouldn't otherwise get it. The people who work here are doing an invaluable service.
I've been here for 6 months, and every day I see patients that come through our doors and their stories just pull on your heartstrings. I think there isn't one story that stands out. I think everybody's story here has been so heartfelt, and if it wasn't for our clinic, I think these patients wouldn't have the care that they truly deserved. At Open Door Health Center, I believe that the mission for our clinic is to take care of all families. Patients come first and will always come first, no matter if you can afford the health care or not. We still will treat you just like you deserve to be treated.
I love how we take the patient-first approach here at Open Door. We are always looking to identify how we can help the patient experience, how we can help ensure that all of their needs are met here. It is very much our number one priority.
We had a patient who had been struggling with mental health, and when he came to us, he was in crisis. He had no one, he had no supports, and his statement to me was, I didn't know who to call, so I called you at Open Door. And he knew that this was a safe place for him to come, and we were able to provide all of those integrated services for him. It was an awesome experience to know that we were the place that he knew he could come and that we could deliver that.
We are helping patients focus on their wellness outside of Open Door Health Center. We want them to have accessibility to health care, and once those basic needs are met, they can also focus on becoming self-sufficient.
We wrap our arms around an individual and try and take care of the whole health of that individual instead of just one particular segment.
Our school-based dental outreach program actually serves 16 schools in southern Minnesota. The school-based dental outreach program is a highly effective way of addressing dental cavities early on in children. Children from low-income families are twice as likely to have a higher decay rate, so we want to address those concerns early. You would be surprised with our kids that we're seeing in our community, the amount of decay, the amount of pain some of these kids are in, and just the inability to find a dentist that'll take their insurance or just getting the care that they need.
At Open Door, we have people who come in who are hurting, who are broken, who don't have any place else to go. And when they show up here, literally unable to stand, literally with nowhere else to go, and we are able to provide services for them, that is why I'm here at Open Door. That is why Open Door exists, and that is why I think it is important to keep Open Door moving in the right direction, to grow, to be able to serve more patients, to be able to continue with our mission.
When I saw, as I advanced my career and saw that we had people that were falling through the cracks, I said to myself, there's got to be a better way. We need to be partners with the community in order to serve the uninsured, underinsured, and meet the demand that is facing us. What we bring into the community for healthcare through grants as well as donations helps everybody. But the most important thing is we have a healthier population, and that's what we want to achieve. A healthy population is a healthy community and region, because everyone
deserves an Open Door.
Everyone deserves an Open Door.
Everyone, our friends and our neighbors, deserve an Open Door.